It's been 316 days since I had surgery done on this eye. I had an IOL inserted, and about a week later I realized that there was a problem, that they had inserted a lens that made me very farsighted. I've had follow-up checkups since then, and had one almost a year ago, not quite a year ago. And the result of that wasn't good. I mean, we went round and round and there were no real options, and so I've been kind of sitting on it for the last roughly 300 days, hoping that I would get used to it, that something would change. Anyway, yesterday I went in for what I thought was a follow-up checkup, and it was very odd. I mean, they did the usual refraction type thing on the eye, you know, where they measure your eyes and by the technician, and that was all normal. But when I went into the doctor's office to talk, and what was also unusual is they, even though I had an early appointment, they saved me until right before lunchtime when the office was clear to bring me in and talk to me. The doctor didn't do the usual measurement where they put your face in there and then kind of check through your eye. She didn't do that. She immediately began to talk about options from where I was, and I thought that was kind of odd. Yeah, we just kept going around in circles, and there were no really good options. And finally I asked her, I said, "What is your specialty?" Because this is the fourth doctor I've been to at this hospital. And she said, "I do cornea surgery." And I said, "With your specialty, can you fix this problem?" And she said, "No." And I said, "What am I doing here?" And then it occurred to me what I was doing there was I wasn't actually being an eye patient so much as she was giving me post-surgery counseling on the fact that I'm now disabled and will never be able to do the kinds of things that I did before, and that that I just have to accept this, that's the way it is, that there's no way to fix this. So yeah, we went through all the options. We went through the fact that you can't really remove these once they're inserted. The risk is extremely high of further damaging the eye. They had some really bizarre options, like doing the same type of thing to my left eye and making it equally bad, which seems bizarre. I mean, making it equally farsighted so I could wear one pair of glasses, but then that would mean that I'm almost blind from 2.5 meters to my eyes. Everything between my eyes and 2.5 meters would be totally blurred. So yeah, those just all sorts of really bad options. Anyway, yeah, it kind of shocked me that I was there to do counseling to accept the fact that, you know, I'm now handicapped and that all the things I love to do before I cannot do. So, for example, if you like driving cars, well, I can't really drive safely now. Like if you fly airplanes, if you're a pilot or something, you can't do that, and you're going to have to give up your license. If you're a welder, if you do things that require, you know, precision with your eyes, sewing, if you like sight reading music on a piano, something like that, yeah, it's either going to be impossible or extremely difficult. Yeah, so that's kind of the result. I screwed up. I should have gone to multiple doctors and gotten opinions and so forth, and I did not. I failed to do that, and I'm smart enough. I should have known. Okay, so that's the result. It's not a good result. Not happy with it, and I'm going to have to, frankly, it's going to take a long time to accept this. So, what should I have done differently? Well, in my other video, I think I said something about, yeah, I should have gone to other doctors. Yes, now I've gone to several doctors and it's too late. But my advice, I'm not a doctor, I'm not medically trained, but my advice to you would be I would go see 3 doctors at 3 different institutions, not 3 doctors at the same institution. 3 doctors at different institutions. I would have 3 different measurements. Don't just go talk to the doctors. Get 3 different measurements, compare those measurements, and make sure they all agree. And if one of them doesn't agree, or any of them don't agree, do something. You know, find out why. I should have done that. That would have prevented my problem. Yeah, find out everything you can before. It's up to you. Sadly, you know, doctors oftentimes work for themselves. They work for the hospitals. The patient nowadays is oftentimes second. So yeah, learn as much as you can, understand the options, and do it. I mean, don't accept somebody's word for it. Force them to tell you what's happening. Force them to make it clear to you. And if they can't, go somewhere else. Find somebody else. Okay, well, I don't know what else to say. It's going to be, I'm going to wait as long as I possibly can before I do my left eye. I do have a cataract in my left eye. It's not aggressive. It's forming slowly and it's small. So I'm going to wait as long as possible. Perhaps technology will change in the next 5 years or so. And yeah, so it'll be a while before I make another video on this. Okay, well, I hope you find this useful and interesting in your future healthcare.